Hello nurses and hello world, this is nurseniezl and welcome back to my channel. Is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, today I am going to show you another Osce skill, another Osce station. And this is fine bore nasogastric tube insertion. You have to finish this station within 12 minutes. They may mention that ID check and consent has been done and all you have to do is to perform the procedure. So, that's it. That's all you get to do. However, if they hadn't mentioned any of those, please still do check the ID and inform the patient, then gain consent. Alright? Remember nurses, they may inform you that all equipments are arranged and all you have to do is to check if they're clean and intact and their expiry dates. However, if they hadn't mentioned that, if the examiner didn't mention any of those, then you still have to get your materials, check if it's clean and intact, and check the expiry date at the same time. And since you're going to insert a fine bore nasogastric tube, you have to make sure to determine a displaced NGT, which we're going to discuss later on, and I'm gonna mention it when I do the skills, okay? In addition to, you also have to recognize the significance of checking the patency of that NGT tube that you've inserted. So you still have to check that, which again, I'm gonna mention it later on, okay? When I do the skills. Alright, so are you ready? Yeah? Okay, so before we get into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Can I just remind everybody, I have a membership channel in which you can click the join button and see those videos that are just exclusive for the members, okay? And also, one of your perks is that you will be able to see the videos first before anyone else, if you are a member. And if you got any question for me, it will be pop up to the top and I'll be able to see your questions and answer it as soon as I can, okay? As soon as I can. Are you ready, nurses? Let's go. The examiner will give you the scenario that looks like this. So the first thing I'm going to do is to wash my hands using the steps of hand washing in accordance to the World Health Organization. First, wet your hands. Obtain some soap. 5 backwards and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of the palm with finger clasp. Rotational rubbing of the wrist. Now rinse it thoroughly with water. Pat it dry with clean towels and dispose it in the domestic bin. Now that my hands are clean, I'm gonna prepare the materials that I'm gonna be needing on this scenario or in this station. So before that, Miss Examiner, is this trolley clean with soap and water and ready to use?
Yes.
Okay. Again, if it's already prepared, just check if it's clean and intact and check the expiry date. But now I'm going to show you, just in case it's not prepared, I'm going to show you how it's done. Alright? So preparing now my articles, I get here the kidney basin, warm water, gauze, clean and intact. Expiration date is 23rd of the 12th, 2030. 50 ml syringe, clean and intact. Expiration date is 5th of the 6th, 2027. Hypoallergenic tape or plaster, 2 of them. Expiration date is 1st of January 2030, 1st of January 2030, clean and intact. Okay, feeding tube, size 8, expiration date is 1st of the 1st, 2030, clean and intact. So we got here the pH strips, expiration date is 1st of the 1st, 2030, clean and intact. Miss Examiners, this pH strip has been stored properly and not been exposed to air.
Yes, it is.
Okay. So I got here all the materials that I need for this procedure. I'm gonna go now to my patient. But before that, I'm gonna grab some gloves and apron. Gel my hands. And let it dry for 30 seconds. I'm gonna go now to my patient. Okay, I'm gonna go now near to my patient. Hello.
Hi.
Okay, making sure that the scene is safe and provide privacy and dignity to the patient. Okay, just gonna gel my hands. Let it dry for 30 seconds. And of course, according to the examiner, ID check and consent has been done. So all I have to do is to proceed with the procedure. Hi, I am Nizel. I'm going to be your nurse for today.
Hello.
Yeah, so, is it okay if I call you Miss A?
Yes.
Okay, Miss A, I am here to insert in fine bore NGT tube, if that's alright.
Yes.
So according to your doctor, you're gonna need this NGT for your feeding, okay?
Okay.
Alright, so are you happy for me to proceed?
Oh, yeah.
Okay, so before that, are you alright in there? Are you comfortable?
Yes, I am
Okay,
comfortable.
are you in any pain at all?
No, I'm not in pain.
Alright then, so I can see that you're sitting down because this procedure requires you to be on an upright position. Are you okay with that position?
Yes.
Do you want any pillows at the back of your hands so that it will prevent you from tilting your head forward and backwards?
I think I'm okay.
Alright then. Okay, I'm just gonna gel my hands and let it dry for 30 seconds. I'm gonna wear my gloves now. Alright, so before I start the procedure, Miss A, we're gonna arrange a signal. So for example, I need you to raise your hand to communicate with me if you want me to stop the procedure, okay? Is that alright? So
yeah.
Just raise your hand if you want me to halt or to stop.
Alright.
Okay then. Okay, so I'm gonna grab this gauze because we need to check the patency of the nostrils, okay? And another one. Alright, so they're both patent. Where do you want me to insert the fine bore NGT?
On my right nostril.
Okay, on your right nostril it is. So I'm first gonna do an NEX measurement, which is your nose, your ear, and your cephasternum, okay? So I'm gonna open the feeding tube. Alright, let's measure. So I am going to select the appropriate distance mark on the tube by performing an NEX measurement, okay? So we have to select the appropriate distance mark on the tube by performing an NEX measurement. So to do this, using the tube, measure the distance from the patient's nose, yeah, to their earlobe, plus the distance between the earlobe and the bottom of the cephasternum, okay? So I'm gonna do that now. The tip of the nose to the earlobe and the cephasternum. So this is not a proper mannequin. So assuming that this is now the cephasternum, I'm gonna put the location of the cephasternum here. Yeah, okay, right there. Okay, so when you see that point, that's the cephasternum. Okay. Okay, so I got here the marking, which is 50. Okay, so what I'm gonna do is, so we got 50. What I'm gonna do is I'm gonna add 5 to 10 centimeters, taking note of the measurement marks of this tube. Okay, so we've got 55. I'm just gonna add 5 more. Okay, so 55. So this is now nurses my NEX. Of course, you have to make sure, nurses, that there's a working oxygen and suction at the bedside. So I'm gonna put this receiver or kidney basin here, just in case. Alright? So let us lubricate now the tube, okay? Lubricate about 15 to 20 centimeters of the tube in the warm water. So now that it is lubricated, what I'm gonna do, I'm gonna insert it now, okay? I'm gonna insert the proximal end of the tube into the clearer nostril, yeah? And slides backward and inwards along the floor of the nose to the nasopharynx. Okay, Miss A, are you ready? I'm gonna insert it now. Again, if you feel a discomfort or if you want me to stop, raise your hand, okay?
All right.
All right, here we go. So I'm gonna insert it gently to the clearer nostril, backwards and inwards, along the floor of the nose to the nasopharynx. Okay? Again, I have to remember that I have to stop if I feel any obstruction and try it again in a slightly different direction or try it on the other nostril, okay? Okay, Miss A, I need you to start swallowing. If you're able to, as the tube passes down the nasopharynx into the esophagus, okay? Okay. Okay, we're almost there. Are you alright, Miss A? Advance the tube to the nasopharynx as the patient swallows until the predetermined mark or the NEX measurement. There you go. So now that we've reached the NEX measurement, I'm gonna put a plaster on it, make sure that it's fixed. So I got here the adherent plaster, so we need to secure this tube. Okay, so we're gonna put now the tape. So we still get the measurement right over here. Okay, so for this one, I just have to tape it right over here. Okay, so we need to use our 50 ml syringe to aspirate a small amount of stomach content. Okay, connect it here, spigot. Okay, we have to aspirate small amount of from the stomach. And then you have to close the spigot. Okay. Now I'm gonna get the strip. Just get one. Okay, so I got here now the strip. As you can see, these are the colors that you need to compare against the coloring right here, which is your pH test. Okay, so the pH should be below 5.5. Okay, so we'll see what this color would mean. Okay, so I got here now the reading. Let's see. So we have to compare now the result in here. Okay, come on. 2, 2.5, 3, 3.5, 4, 4. Oh, I think the color is 3.5. Do you agree? So the pH strip compared to here, the result is 3.5. So that's it. We are now done with this one. Miss A, are you alright? Are you comfortable with this one?
Yes.
Okay. While doing it, while inserting it, I have to recognize any signs of distress such as breathlessness and coughing. So if that happens, I have to immediately remove the tube, the NGT tube, and then try it again. Okay? So Now I'm gonna dispose everything in the clinical waste bin because they've all been used. So remove my gloves. Remove my apron. Gel my hands. And let it dry for 30 seconds. Miss A, are you comfortable?
Yes.
Are you in any pain?
No, I'm not in pain.
So, I can see that it's placed really good, but I need to carry out additional checks. So I need to I have to regularly check the positioning of the tube, and especially before feeding. I will also need to check it with the pH strip. So every time before we do the feeding, I need to do a pH strip again. All right. So pH strip check. And of course, there's a specific circumstances that we have to check it radiologically, okay? So you have to go to x-ray and let it be seen if it's really in place, all right? Again, I'm going to regularly check the positioning of the tube, all right? Aside from that, I also need to check the skin integrity because I placed some plaster on your nose and on your cheeks. So I need to regularly check the skin integrity every 2 to 4 hours, all right? Through this procedure, I'm gonna document the things that I've done with the patient, including the NEX measurement, plus the visible portion of the tube from the tip of the nose. Okay, I have to document those things with my signature, time, and date. Alright, so after the procedure, I'm gonna make sure that this pH strip is stored appropriately and in the cupboard. Also, I'm gonna wash this trolley with soap and water. I'm gonna wash my hands with soap and water after the procedure. I'm gonna go now. Are you comfortable?
Yes, I am.
Okay, so if you need me, here's the call bell. Please do give us a ring, okay?
Alright.
Alright, thank you very much for today. I'm gonna go now, okay?
Okay, bye.
Okay, gel my hands. And like I said, I'm gonna wash my hands using the steps of hand washing in accordance to the World Health Organization. And just like that, that's the end of this procedure. Again, I hope you learned something for today. If you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Oski videos, then hit the notification bell. And comment down below what other Oski videos you want me to do next. Please do join the membership. And thank you very much for your support. This has been nurseniezl. See you on the next one. Bye! Now we have come down to our shout out for the day. I would like to welcome to the team at Akansha Esther Verma. Hi there! Shout out also to one of our members at Angel and Ann. Also to at Divya Pangilama Gurung. Welcome to the team. Thank you very much for supporting our channel at Elizabeth Atiano. Last but not the least, we've got at Teresa Renojo. Welcome to the team.